You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. My guest today is Ann Clement. She is the Director of Programs for the Wyoming Chapter of the Alzheimer's Association, based in Cheyenne. This is actually part two. On part one, which you can still go back and check here on our channel, we talked about how caregiving affects finances, and it certainly does, and the legal and financial documents that a family may consider securing, very vital documents, the durable power of attorney and the living will. So if you have questions about that, we invite you to go back and take a look at part one. And thanks again for being with us. In part two, we want to talk about, now that we have kind of those things in place, preparing for financial discussions. So what is preparing? I mean, mentally, or getting papers, or what is preparation?
It can be a little bit of both, and it can even be writing down what you want to talk about, what you want to discuss with your loved one, and your goals. So identifying who is going to have that conversation is certainly an important part of the puzzle. It can be somebody that may be a little bit outside of the box. It could be someone that your loved one worked with for years, or is part of your church organization or a civic organization. We have to remember that when we talk about, being a caregiver, you and your loved one have a baseline for your relationship. And it may not be easy for you to address finances with your loved one. It may come better from a different voice. So just kind of keeping that on your radar screen as a reason to consider having someone else a part of the conversation. But what's also true, we have to remember that these hard conversations, they're so hard and they can give us a lot of anxiety. But once we have worked through them, we all feel so much better on the other side of that conversation. We do have a program on our website that's called Dementia Conversations, and it's specific to having that hard talk with your loved one. And so our training.alz.org has all of our free educational programs, and that Dementia Conversations walks through how to approach your loved one, not only about finances, but also about long-term care choices and things like not being able to drive any longer, things that really change their day to day and can be difficult to address, but definitely need to be approached.
In part one, we talked about, as I mentioned at the start, the durable power of attorney, the living will, the importance of creating a care team. And one of the things we also discussed was that it's never too early to begin these discussions. What happens if, for whatever reason, a family doesn't get around to having these discussions until maybe after the loved one is no longer able to make decisions or choices for themselves?
There's still the capacity to otherwise make those legal documents legal, because once your person, through medical designation, is no longer able to make decisions on their own, you still have access to that kind of oversight for them. But it really is important to get those decisions made ahead of time as soon as possible so that you can get those documents signed. It's a lot easier. There's just much less burden for you as the caretaker to have that designation made, and then you can have those documents signed with your loved one.
You mentioned it back in part one, you mentioned the 24/7 helpline that's available, and that number we'll make sure is here included in the program, 800-272-3900. When they call that number, can they get answers to questions like these?
Anything that you need or that you need resources for, you can call that number for questions like legal and financial concerns. You can call about daily caregiving. You can call because you've just had a day and you need to talk to someone and you really just need to kind of say some things out loud, and maybe you feel like you can't say it to family. That 800 number is truly a resource of all varieties for you during caregiving or as a person living with a diagnosis.
We talked about, the financial part of it is a big part. And
When you spoke to the Wyoming Dementia Together group back in September, you talked about identifying steps to reduce financial abuse. And I guess my first question is that common? Financial abuse?
Unfortunately, it truly is. Every year, there's about $39,000 that are lost on the average by someone who is scammed or exploited. And only a fraction of those are ever reported because oftentimes it can even come across as something unintentional, but money gets used for things that they weren't ever really given permission for. But there's a lot of ways, or even done accidentally, where someone has used a credit card on items that they wouldn't have otherwise purchased, but now their judgment is altered and they're, going through with purchases that can't be refunded for whatever that reason may be. So there are a lot of things that you can do to help kind of just guide financial decisions. You can agree to a charge or spending limit on the credit cards. You can create separate accounts. That's definitely something I've heard is a great skill or a great tool for kind of keeping track of letting someone have their autonomy on still spending money, but not giving them access to a full checking account where they may otherwise compromise their capacity to pay for their mortgage or their utility bill or something along that line. You can set up auto pays for things so that you're not having to worry about checks going through twice. You can make sure that there are withdrawal limits on bank accounts. We can go in and oftentimes, especially in our smaller spaces, and we're very familiar with our banks, we can go in and chat with our bank loan and all of our loan officers to talk about what our person may or may not have the capacity to do anymore. There was legislation passed this last year for financial exploitation of vulnerable adults. So if a transaction has gone through at a bank that seems fraudulent in nature, the bank does have the authority to hold that transaction for up to 5 days. It won't freeze the entire account. It will just hold that single transaction. And then law enforcement and adult protective services are brought in to take a look at the entirety of the case to understand whether or not there's a fraud concern there. But it's a great way to just expand that community safety net for our older adults as they age in place, and we're sure we're able to keep them as safe as possible.
We hear a lot about telephone scams. Is that a problem too?
Absolutely. Telephones, cell phones, those links that you just have to click this link and give us this
Mhm.
very basic information, and we'll send you a gift card from Walmart for $300. And it sounds so easy and doesn't seem like it can be that dangerous, but they can use very basic information these days to then otherwise move forward on setting up accounts under someone's name, if they have their home address, and especially if they have their birthday. It's very easy to unfortunately replicate someone's identity if they have enough personal information.
How do you identify or how do you negotiate if your loved one with dementia doesn't want anybody messing with their finances, doesn't want limits put on spending, or wants to write their own checks or whatever? How do you negotiate that?
It's not going to be the easiest thing to do, and sometimes it takes several tries at the conversation to get around the idea of why is it that I'm keeping you safe and keeping your money safe. It's not about taking away autonomy. It's really about making sure that we have enough in the bank to cover bills and to cover unexpected costs like medical equipment or doctor's visits or things of that nature. But sometimes it really is just having those conversations more than once and then checking in with other providers that interact with your person so that they're able to keep track of or keep tabs on things that are or are not happening that they may have a concern as well. So talking with your doctor about that so that they have that same conversation with your person, reaching out to the bank and just letting them know that it would be really nice if we could keep an eye on anything that seems out of place. And so at that point, you're not asking to be told what is happening, right? You're not having an oversight that may be a little too much, but you have extra eyes on what's going on for your loved one.
I think that's fabulous advice to get a hold of the financial institution and just say, hey, this is the situation. This is what's going on. And I would imagine that most of them have been down this path before. I mean, it's not something that is going to be new to a bank to kind of oversee and account for these reasons, right?
I would agree with that. Absolutely. I think that, if we think about just statistically, over the age of 65, it's 1 in 8 of us who suffer from a dementia related concern. And over the age of 85, it's 1 in 3.
Wow.
So it really is a more prevalent concern than perhaps we're all aware of. I think we think that there's a certain amount of memory loss and things that go along with age, which is true. But
Right.
the change in judgment capacity is certainly something that's different and more concerning. And so I suppose regardless of your dementia status, you certainly would want to just have eyes on those changes in someone's financial space as they age.
My guest is Ann Clement. She is the Director of Programs for the Wyoming Chapter of the Alzheimer's Association, based in Cheyenne. We invite you to subscribe to our channel. We hope that you'll hit that thumbs up, like button, pardon me. And if you will subscribe and hit that button, both of those actions will help us, our channel to grow and allow us to reach more people. And if you will tap that notification bell, and that way you're going to be alerted each time we upload new content. One of the things that you talked about in your presentation back in September to the Wyoming Dementia Together group, and we'll have information about that group in the dialogue box below. You talked about the importance of creating a backup plan. A backup plan for what?
Well, we always think about caregiving and often caregivers we really don't think outside of the box for other resources because it may not be intuitive. If you didn't grow up looking for resources when it comes to providing care within the home, it isn't really on your radar screen for how do I do this from outside my house. So if finally you do come across, the Meals on Wheels, and there are other things that you can do that will continue to arrive at your home that doesn't require an extra person on that list of a care team. But what if you as the caregiver can't do those things anymore? And what does that look like? So talking with friends and family members about different caregiving responsibilities that they would be willing and able to come and take a part of for you. So managing money is definitely one of those things. It can be the in-home non-medical care. So there's a lot of different things that could be just very light housekeeping, helping with the laundry, picking up some groceries. There's a lot of things that we do every single day that maybe we don't realize as caregiving, but it's otherwise keeping that household up and running as well, so that you and your loved one are able to continue to age in place for as long as possible. And those are all non-medical kinds of things that you can definitely split up and just make one person have one task, right? So you have one person you rely on for the grocery delivery, and you have one person that comes in to help you with the light housekeeping. It really just depends upon kind of the bevy of friends that you have, and the tasks that you've identified you're comfortable with splitting up amongst your loved ones.
Sounds like it'd be a good idea to put together a care team. Is that right?
And luckily, we do have even a template. We have a calendar template that's
Yeah.
on our website. So you can go to the alz.org and go to our caregiving page. And we have a variety of templates that you can select from to kind of walk you through all of the things you need to have on your radar screen as part of caregiving, just to make sure that you have them there and you're aware of them ahead of time.
Man, it seems it's so easy for it all to be so overwhelming. But I always like to come back to this question in talking about things like this. If you're a family member, your loved one has received a dementia diagnosis, where do you begin? What would you say is a good first step to try and get acclimated to your new life as a caregiver? What's the first step?
I would always suggest reaching out to either, whether it's Wyoming Dementia or if it's through the Alzheimer's Association, the Center on Aging. There are a variety of resources that really do help to provide a support system for the caregiver. Find yourself a good support group. Be sure that you're taking care of your own health. One of the biggest things for caregivers is that about half of them end up with a chronic disease that makes them unable to provide care for their loved one.
Yes.
And that's really overwhelming. And a lot of that could be avoided just based on the idea that that caregiver needs to keep track of their own health. So getting adequate sleep, making sure that your nutrition is staying up, and that you're getting a little bit of exercise and a little bit of social interaction, and all of those things that help us to continue to really feel whole is just as important for the caregiver as it is for the person with a diagnosis. So connecting with whether a local chapter like ours, there are other support groups that are out there, but finding that space where you can fill your own cup so you can keep your person as healthy as possible is really important to start there.
Some of the best advice I got was that there is so much that is out of your control. Sometimes it's hard to recognize that there are some things that you can control. You can control, your exercise or what you eat or those kind of things. And I think that's a really good point to make. Once again, we want to talk about the 24/7 helpline that's available. We will have that number down below, but it's 800-272-3900, and that also would be a good first step to take after you receive that diagnosis. And there is so much to talk about, and we just kind of touch the surface here, scratch the surface, but we know that the Wyoming chapter of the Alzheimer's Association and Wyoming Dementia together are great places to start. So thank you so much for being with us, and we'll see
Thank you,
you
Scott.
all again next time.
You've been watching once again a YouTube video presentation of the University of Wyoming Center on Aging. We hope, if you haven't done so already, that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.